Hi, everybody. The big takeaways for Chapter 13 on therapies are these. Mental health professionals, now that's psychologists and psychiatrists primarily, use multiple strategies and processes to help individuals recognize, define, or diagnose, and then overcome through treatment whatever their psychological difficulties may be, with the goal of improving their adjustment in the short term and in the long term. So here's the first big takeaway from this chapter. Treating psychological disorders is a two-step process. Recall the two steps are common to the treatment of almost all psychological disorders discussed in our last chapter. Number one, medications come first to help the patient who is in distress, and then they're considered a short-term solution. Second, talk therapy comes second and is considered a long-term solution to truly cure the patient of the psychological disorder. Think of it that way. And try to prevent this from ever happening again. Give them the skills they need for the next challenge that comes along in life, right? So in this chapter, the biomedical therapies would come first, but only if they're needed, of course. If patients are in distress with a serious mental health disorder, medications come first. Then, talk therapy. Behavioral and cognitive therapies are more commonly used with more serious mental health problems. Insight and relationship therapies, as discussed in this chapter, are more commonly used with less serious mental health problems. Now, it follows that talk therapy goes through stages as well, from start to finish. So that's the second big takeaway. Different therapy approaches are used in different stages of psychotherapy from start to finish. After medications are started with patients who need it, crisis management talk therapies are used at the start, and insight-oriented therapies come later on. So at the start, the patient is still in distress with the reasons they came to us for help in the first place, right? Behavior therapies are often implemented first. Behavior therapies are often implemented first to support an immediate change in those unhealthy behaviors that we may see in a patient, like if they're abusing drugs or substances or engaging in some kind of dangerous or risky behaviors in their personal lives. Behavior therapies will often be thought of first when the patient's in crisis. Cognitive therapy, next, often follows teaching clients the three domains of human experience. As you recall, thoughts originate as appraisals or reactions to people, interactions, and situations, and those thoughts, remember, reflect personality, an earlier chapter in this semester. Thoughts then drive feelings with, for example, negative thoughts responsible for creating negative feelings, and then thoughts and feelings together drive unhealthy behaviors. This is the core of cognitive therapy. This is the centerpiece of cognitive therapy. Now, most patients need to be taught this and are understanding these interconnections for the first time in their life. That itself is a real insight for many people, learning how their mind works, basically. Insight therapies would come later. Insight therapies are not crisis management treatments to be used when patients are in the state of distress. Insight therapies usually occur with patients who are well established in therapy when they begin to ask the why questions. For example, why did this crisis happen to me? Why me? They may say, why me, Dr. Gomez? What is it about me personally that is different from other people who don't suffer like this? Such questions require a deeper look within themselves, also known as insight, right? At a time in the psychotherapy process when the patient is calmer, making progress, and seeking lasting lessons from the crisis that they just experienced. Now, before I end this video, I want to address one common question also. People will ask, how does psychotherapy work? One of the most common questions asked, what do people actually do in therapy? Talk therapy is 3 tasks. Number 1, we talk a lot. There's a lot of questions and answers. We discuss problems, and psychologists discuss the originating thoughts, subsequent feelings, and patterns that we see in how a person behaves that the patient does not like. Number 2, all patients inevitably have patterns in how they react to other people and situations. Now recall, personality was defined as characteristic ways of responding. In other words, patterns. So we look for unhealthy patterns and try to determine what those patterns might mean, often looking at one's past life, past relationships, and even back to childhood relationships with parents when it's appropriate. And the third step in therapy, how it actually works, is finding better or other ways of achieving one's goals. other ways of living one's life and of having healthier relationships. So in summary, the big takeaways in this chapter are two. Treating psychological disorders is a two-step process. Medications first in the short term, talk therapy second in the long term. And also, different therapy medications are used from start to finish. Crisis management talk therapies are used at the start. Insight-oriented talk therapies come later. Those are the big takeaways from this chapter on therapies. Thanks, everybody.